All right, guys, welcome back to another episode of PAWCast. We finally got through the center portion of our industry overview. Of course, that's the red section, which is our three biggest problems being culture, talent, and service. So this next video series, which is actually going to span multiple episodes, is focusing on the single-handedly most important thing that can be improved or established within a veterinary practice, which is core values. So in our industry overview, this is actually the top right corner, which core values bridges culture and talent. That can actually be fixed sort of in tandem with one another. But hang in there for the next set of video series, because like I said, this is going to be a several multi-part section as we just work our way around core values. And then, of course, those other components on the outside. So stay tuned, and here we go.
Welcome to the podcast.
Solution episode number 1.
Yeah,
we've laid the picture out of what this hurricane looks like in the dead center. We understand kind of what the eye of the storm looks like here with all of these pieces in terms of culture, talent, and service, and where our biggest gaps as an industry as a whole are. And again, even to jump into that, some of the issues that we deal with internally also, because it's a constant fight to beat these problems. But how do we beat problems? We develop solutions and implement them. So solution episode number 1 here is we're gonna start and essentially see where we end up in terms of the explanation and deep dive into our core values that we have implemented here at PAW.
Yep.
And I think believe in to the point that we would be able to say to any clinic, if you were to take these 4 and implement them to the level that we have, you would experience some pretty substantial increases in success.
Yeah, absolutely. And I think one of the things, this is kind of an ongoing sort of point of conversation or question that Ben typically throws at me, and part of when you were working with us primarily just on the consultation work, was we'd have this huge issues list, and our issues list, of course, was pulled from the kind of center portion of our industry overview, the culture, talent, and service. So this huge issues list, and what you posed to us then, and then of course we still ask ourselves now, is which of these are industry problems and which of these are PAW problems?
Right.
Like which one is it's just you guys in house, but which one of these is actually going to be more industry driven? And a lot of times the answer was, well, it's kind of both. But it was really more so of a question that came from, well, where are we actually going to be able to institute change? Like if from this issue, like we're going to create a to-do list for this week, the to-do list for this week can't be change the industry. Like that's not really like a realistic to do.
Right.
But yeah, so that's where I think, when we look at this industry overview and we start to kind of expand upon that and saying, how do we actually change the day-to-day? How do we change our things internally? It is, like we said, is instituting kind of these 4 parts. Is this used to be all we had in the section 1, page 1 of our employee reference text.
Right.
And you'll probably hear us abbreviate it just to make it quick is, you're told, right, as a veterinary owner, or owner of a business, is there's some things you just have to have. You have to have a mission statement. You have to have an employee manual. You have to have these things. You have to have these things. You have to have these things. But kind of like you had said before is, part of the reason why we make tools is to unbreak things. Well, these things that had been sent to us or told to us, you have to have this. You have to have a mission statement. Well, like you had said before, it just becomes like a writing on the wall.
Yeah.
It's just like a sign where you're like, oh, here's our mission statement.
Yeah.
And then it's like your employee manual is, oh, it's just this thing that administration put a ton of work into, and that's just going to sit on the shelf over there.
Yeah, all of these things that are we have found to be very critical are dust collectors.
Yeah. You put tons, and even some of our consultation work we've done with other businesses, like we've put ton of time and effort into creating these resources for the organization, and even the work that we put into it for them within their organization, it still ends up collecting dust because they don't understand how culture and core values go together so significantly, and that's why. In the center of core values in that section is sort of this sort of 4-piece loop, this 4-piece circle, is that was the first page of our employee reference text. So for us, our employee reference text, we don't call it an employee manual, is we really actually have our employees refer to this whenever they need. So okay, fine. How do you request PTO? Yeah, that's in there. That's very kind of core to employee manual. But it also has the stuff for onboarding. It also has all the parts for culture. It has the tools of the after action report or the forgiveness model. All these different types of things are in. I don't know. The ERT's got to be up to, I don't know, the same thing. It's probably in this
60 some
page. Yeah, I was gonna say 60, 70 page thing.
Yeah.
Which, like you said before, you don't need all the pages all the time.
Nope.
But it's something to reference at a later time.
Exactly.
So, so for us to look at then saying these core values, this was just page 1 of the ERT, and it
still is, by the way.
Yeah, I was just looking at that. Yeah, section 1, page 1.
Yep.
But we used to kind of jokingly say that it's the section so important that it only has 1 page. Well, now it has 14 pages. But at that time, when we look at what we had for culture and core values, it was we kind of had our 3 big pieces. We had our vision, our purpose, and then our core values. And for us as an organization, taking that sort of like big picture to like sort of medium-sized picture to then a little bit more medium to then getting us down into the small picture day to day. I think that's where when you sort of lack clarity and you lack unity in that process, it's just like, well, what difference does it make that we have employee reviews, peer reviews, annual reviews, whatever you want to call them?
Yeah.
I mean, why does any of that matter?
Well, and that translates into, as an employee, why am I here? What's the point?
Yep.
I'm just, especially using the words that we've used multiple times. I'm just surviving.
Yep.
And there's no purpose behind this whole thing. So that's why in the middle of our core values, ultimately, they all come down to serve the patient. When in doubt, with any decision making that happens within our clinic and within the business as a whole, how does this improve how we serve the patient? We do that through our 4 items, which again, it's just a breakdown of we are accountable to each other and to the patient. We give trust, we gain trust, we respect each other, and we respect caregivers, and we create and we maintain unity. That's a breakdown of the 4 most essential pieces within serving the patient.
Absolutely.
That's why we all show up to work every single day.
Yep.
So within that, what that provides for us is a framework, again, within decision making. This is why core values, in my opinion, are so terribly critical, because if you don't have this to serve as a guide, what ends up happening, and I've seen on multiple occasions in multiple different industries, is if I don't have this guide in the decision-making process, I over time will start to make decisions that exclusively serve myself.
Sure.
Which becomes very, very difficult to build a team, to create unity, and to have ultimately a consistent process throughout, because I'm going to do this my way and you're going to do this your way, or whatever it might be. It's just whatever the decision was, and then you went your way and I went my way. Any difference in there just provides the opportunity for completely unnecessary conflict, and for processes to become very inefficient over time. So
2 huge things in our profession.
Right.
Yeah, inefficiency of process and unnecessary conflict.
Right. So that's why when we say, and we're going to take a lot of time to explore these things, it's not because really what I think the general impression of these cultural definition items is that they're touchy-feely, they're nice, they make us feel good inside, but the the effective implementation of them really doesn't exist because they're just words.
Checklist items.
I can't say how many times I heard like those are just words on the wall or within our book,
Words on
like,
the
but they
paper.
don't ultimately the world is too different from these things for me to actually do them. It's like, well, no, you create the world that you live in by buffering all of your decisions through these items. And it's a constant struggle to do that because you have to always have that filter of decision making in your head. And thankfully, we've gotten to the point, at least for the most part, that a lot of our staff does that. But again, it's a constant fight. So
especially when new people come into the team as well, who are less familiar with that decision making guideline or that decision making process.
Yeah, there's a big learning curve in that because it's so, and again, outside of just the veterinary industry, it's a very uncommon thing to have exist as a whole.
Sure.
You look at some of the most successful businesses. At least the ones that I worked with, they all shared the same variable that they knew and lived their core values. Everything else was kind of a detail after that. Versus the core values just being some minor detail in the background.
Which I completely agree from that statement, having seen both sides of core values, right? So I mean, like I said, it was a checklist item. I mean, I've had it with past employers. I've had, it was instituted prior in our clinic, but like you said, it's always sort of like a footnote. It's like, oh well, this is what it is, and it's kind of like these like very, like you said, kind of the touchy feely stuff where it's just like, oh, we have this very nice core value, we have this, and this is what we're all about, and this is who we are, and this is what we're doing, and it's like, okay, I know, we're all here, we all have the same job, sounds great, but who cares,
right?
But for us, it's taking that, from the vision, for us, the vision is sort of, to exist, it's kind of being a force of change within the veterinary industry, coming right down to the next tier down as our purpose, which is learn, uphold, and teach core values, of PAW Health with the sole intent of maintaining service to the patient at all times. That's step 2 for us,
right?
And then coming into the core values, like you said, the accountable, trust, respect, and unity, that bleeds out into everything else, into performance reviews, into performance growth, to, onboarding, TriCore, is like you said, is it influences every decision that happens in the company. You can tell, like, when we do have conflict, it's like, well, you guys had conflict because there is this, particular chain. We just had a discussion today between the interaction of 2 employees, and this plays off of something we'll touch on a little bit later about the drama triangle, or the drama dynamic of between victims and rescuers and persecutors. Is that this one particular employee said, every time so and so comes to me with a problem that is their job to do, I just say screw it and I just do it for them because it's easier and it's going to affect patient care if it doesn't get done. And it's like, well, let's look at it from a core value standpoint. Is they don't respect you enough to understand that it is inappropriate for you to do their job. They trust that you're actually going to be able to get it done, but all the meanwhile, you're playing the rescuer to their victimization, which ultimately is affecting the unity of our team.
And by the way, we can't hold the person that can't do their job accountable because this thing that they didn't do, like, we don't know that they didn't do it.
You got it done for them. And as far as we're concerned, the job got done, but it didn't get done by the person who is accountable to that particular task, which so far in that one little thing was literally every core value.
And then over time, as you continue that habit, what does it do? It creates unnecessary conflict and inefficient processes. Like, that's really what it comes down to. So we don't say these things lightly. We don't say we don't push these items as like paint them on your wall. But really what it comes down to is if you are a member of an organization, regardless of industry, especially if you are at an ownership or an administrative management level, one of my favorite things to do on the consultation side was going to the owner and saying, what are your core values? They'd never know it. They'd never have it. And they never even know where it is. Like, they would scramble for it. My challenge to everyone that's listening to this is know them and do your damnedest to live them. Because what you'll find is you'll likely, which is funny because these haven't changed since I've first seen them, which is kind of, you struck the golden chord.
3 years ago.
3 years ago, right. What I had seen with other businesses is they would be a dynamic. They would say, let's define
sure.
let's define these because we really don't know what they are. Let's push it through. And then 6 to 9 months later, they'd say, this one's important, but we've got this other thing that, is more important. And there would be some argument of, I can only have so many because I really need these to be my decision-making buffers. So they would be, a little bit variable for us, again, having struck a bit of luck as well as putting the effort to implement them as they were written originally. They haven't changed in that sense, but it's because they're effective. You didn't miss, and as we've continued to implement them as they stand, it just gets more and more effective.
And a little bit more. I think what maybe to build upon that is like the categorically they haven't changed. I think our clarity in what they are has improved.
Absolutely.
For us, it's like to look at that diagram and to see trust, respect, unity, and accountability. That's what it looked like the first time we had it, was those 4 words. And everyone's like, what? What
does that mean?
Yeah, what does that mean? So it was like, okay, you have, like with trust, you have to be able to give trust, but you also have to be able to gain it.
Right.
It's not just you trusting everyone all the time,
It's not free will in it.
It's not, right. So that's why as we kind of move around it, that's where we've kind of increased this clarity, and some of it is it's been a learning curve for both sides, because to us it's like, well, obviously this is what that core value means, but by the way, we have leadership meetings like every other week, and we talk about this stuff all the time. So
it's funny too, because when we had gone through that performance growth process with one of our employees about a year ago, that was one of the first things that I did was we have these core values. I want you as an employee to define them. Because I want to make sure that we're all in alignment with this core purpose that's potentially creating some performance issues for you. And that ended up being the entire performance growth plan was rooted around getting aligned and fulfilling the requirements of these core values within their performance. Their job description didn't even come into play.
Right.
It was, where are you missing on these key items? Because man, if you can hit these, everything else is going to fall into place. So basically,
which on that is actually part of what our performance review system is.
Yes.
Like, we have coming into our growth, let me see here. Is that there's we say that there's 2 jobs in our organization, and those 2 jobs on one hand is what your job description is, and the other side is like, essentially your cultural description, or your cultural job. So those are 2 like equal halves to the circle, and that's then of course bleeding this all out into multiple parts of our process, which again, looking at the industry overview, you'll kind of see we start to talk about the performance growth, and we start to talk about these other little pieces. They're still so heavily rooted in what is your job. And a lot of people say, well, I'm a hard worker. So that's what we always get back. I'm a hard worker. I'm a hard worker. I'm a hard worker. And we've lost hard workers. And part of that loss in hard workers is like, well, they're only working hard according to their definition. And their definition is, okay, of my job description, I'm performing that's one of my things at performance reviews too. I ask them on their job description, how much of your job description, so here's your 1-page to 2-page job description, how much of this job description do you think you're doing well? And your hard worker will always answer 80 and above. And for us to look at it then administratively and objectively and saying, in your job description, you're probably doing about 40% of that very well. And it's not just, a crap fest, at this particular review, is to say, no, there is a little bit of a disparity between where you think you are basically working hard in just the parts that you like, and just the parts that you are most familiar with, but your job description has so many other parts that you are responsible for, and that's why we have a high rate of pay, is because for us, we have an expectation of performance. When you took this job, you said, absolutely, I can do all of these pieces in my job description, no problem. You're sort of not, but guess what? That is also only half of the job, because the other half is this. So if you're doing nothing culturally and you're doing half of your job description, how hard of a worker are you actually? You're doing a quarter of the job. So that's where, we've kind of have this understanding that, with core values, you could obviously put some of the blame back onto administration, and say, well, you never taught core values and you never told me what that expectation was. And you never had this. It's like, all right, well, we have one person, Annie, who's our senior accountability officer. Like the whole first 32 hours of your employment was doing nothing other than going through our employee reference text and onboarding you with our computer system and showing you those job responsibilities. And then you had a 3-month introductory period. This whole first 3 months was learning the job, learning the culture, learning all of those parts. Like what part of this wasn't you being taught what the job is? And that's where when we start talking about living and breathing core values, it's everything is built around these 4 pieces. And those 4 pieces are all built around one common purpose, which is
serve the patient.
Serve the patient.
Absolutely. And diving into, really, we just pick one, right?
Yeah, absolutely.
I think we hold accountability to the last because that's going to dive us into our next item.
Yeah, and we have multiple pages on accountability.
Yes. But starting then with give and gain trust. This is I find this one very interesting because for multiple reasons is that within our clinic and I think within the industry as a whole, we have an understanding between individuals, like because we're highly altruistic, is that basically we want to trust people because we want to help people, and in our case also, we trust people because of the patients that they bring in, because ultimately we want to help those patients. And to go along with that, we've got that side, which is a positive, but on the culture of our general nation, less and less trusting every single day. It doesn't really exist a whole lot anymore. At least like a general rule of I take your word for it. Sure. I guess is probably the best way to put that. So we have conflicting things that are within there, and when untrained within those pieces, we get people that don't know how to trust, but they want to. So when we say give trust, that's the altruistic side, but gaining trust is kind of learning how to put yourself in a situation to have coworkers, managers, caregivers, patients all trust you, right? And so these conflicting ideas provide us the opportunity to create a big difference in an individual's life that comes to work here, because you're providing a skill set within something that's pretty dang difficult. But it also allows them to set the stage for defining their purpose in life. So in some cases, that when you have trust on both of these sides and it's effective, all of a sudden, like your worries kind of go out the window. So when you had originally written trust into these core values, I guess, what were you kind of looking for? Because if I'm a clinic owner or manager that's looking to implement this, why do I want to do it?
I think when you start to give and gain trust, it is, exactly like you said, there are kind of those 2 pieces where you'll have these individuals that they are very trusting. And I think what ultimately ends up happening is that when you have a very, very strong or a very quick to trust individual, they can be manipulated. And very easily. And I think when we kind of get into our accountability section, this will come a little bit later, is we'll start to talk about this drama dynamic or this drama triangle, is that when you have a very trusting person, just openly trusting, is that they're really kind of easy to jump into, well, what this person is telling me must be true. What this person is telling me must be occurring. And that's where you start to play off of this victim relationship, this sort of victim rescuer role. And when you kind of start to hear, we kind of jokingly call it the clucking in the hen house, is when you start to kind of have like blah, 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 and yep, and op, and is that you'll start to have this sort of like, in a give trust type situation, it's not giving 100% of your trust on everything that you hear. Giving trust to me is it's important to say, well, no, we're trusting for the right reasons.
Yeah.
And we're trusting for the right reasons because it also plays into our other core values, and it's also playing into how we serve the patient. So giving trust is a very, very dynamic, like you said, it's a taught thing. It's a very, very dynamic thing to institute a process by which we can give trust to one another in an open environment. Like you said, when you kind of give and gain trust, sort of these worries fall away.
Yeah.
Well, part of it is that you're trusting in people in the right reasons, and you're trusting in them not because you necessarily like them. You're trusting in them because their job performance is high, their cultural alignment is high. You trust them in their medical decision making, because judgment, of course, at least is a part of trust, is that if you have trust, you must also execute good judgment in how to trust.
Right.
But part of that is then saying, well, when you start to sort of have this breakdown in giving trust, it then starts to affect the gaining trust. So if you have an individual who is quick to give trust, there's going to be other people who are maybe more reserved in how they give trust to others. They will be less trusting of someone who gives trust freely, because it's like, well, all she does is she just believes everything she hears. So I'm not going to engage someone like that. Or, you will often find someone who just gives trust openly. They play a lot into, kind of a dramatic type work environment. So you're going to be less engaged with that person if you have reserved trust.
Yeah.
So the gain trust component, though, like I said, to look at trust, to gain that sort of trust, I think is maybe a little bit more mechanical.
Yeah.
And saying, I know how to do my job well.
Yep.
When I am met with conflict, I know what to do. So when I start to see others engaging in conflict, I know what to do.
Yep.
So I would say that the giving of trust can have a bit more of like a gray dynamic to it. But the sort of gaining of trust, I feel like can be a little bit more objective, but you have to be very like structured in mind.
Yeah.
If you as a whole have a tendency to be highly empathetic, in that world where, you can see everyone's perspective and you can see everyone's, sort of their own personal position, you're going to have a much more difficult time giving and gaining trust, only because it all seems like it's all true.
Right.
Right. And, I had read this actually a billboard, but it had said, all of our thoughts are real, but that doesn't make them true. I was like, that's actually highly accurate.
It is.
And that's how we kind of start to look at this trust thing. And, giving and gaining trust, I feel like what's in the middle of that is trusting yourself, and you trust yourself, you can trust in others. But I would say that just in, those kind of few examples, when you're talking about an office administrator or a veterinarian or an owner looking to hire, so on and so forth, that's why trust is so important, is because it plays so many other ties into the culture of the practice on, if I go to this person, can I trust that they're going to get their job done? If people come to me, can they trust that I'm going to get my job done? And that's sort of how you start to play the give and gain off of each other.
Yeah, and the other part too, just to touch on the gain trust side, that I'm a very firm believer in, and kind of our whole I'm sure we'll get to it here as we talk about all of these items, is our culture is built with all of these parts leading up to core values, and ultimately that's what we're trying to fulfill. But the base of this is rooted in forgiveness and humility, right? So first, to gain trust, to me, when you say there's a mechanical perspective to it, there is humility, which requires vulnerability. I have to be humble enough to say when I don't believe I can do something.
Yes.
And to me, when like fulfilling your job requirements to their fullest extent does help gain trust, absolutely. But there's also the other side of saying when I can't do it, or
100%.
when I have, like, even if I'm just afraid of it, or asking for help. Because as soon as you put it out there saying that you require assistance in some way, all of a sudden everybody else around the team, so long as you have this give and gain relationship, is going to say that's really cool. Like, thank you.
Yeah. Thank you for telling us you don't know how to do that.
Before you screw it up.
Yes.
Because because if you don't have the humility, if you hide the problem, or if you start to generate excuses, and we're going to get to the ladder of accountability here later, you start to blame others for these problems, that crushes trust.
Yeah.
If you're going to blame me for a problem that you didn't tell me you had that you didn't think you could do, but you didn't tell anyone, like you didn't have the humility to say it, and then you're going to blame me for it, I will probably never trust you ever again.
Yep.
Like, you just bust me for something that could have been preventable. So
think about the drug constitution we had, or reconstitution we had just the other day. You know, it was I don't know, $300-$400 bottle of medication, something like that, and it was a matter of mixing it up, making sure you mix it up appropriately, put the proper labeling on as far as expiration and so on and so forth, and that task was delegated to someone who didn't really actually know how to do it, or thought that they did, but ultimately ended up not doing it appropriately. And because it wasn't a labeled bottle, it's like, well, we don't really know when this was constituted. It was less than 24 hours old. But the point was, when one of our other employees caught that this bottle wasn't labeled, she's like, oh, red flag, don't have a date of constitution, throw it in the bin. You know,
gotta go.
There was like maybe a half of an ml used out of this bottle, and they just went away $400. You know, so for us it was like, accidents do happen, and that's part of us administration, and saying, you're exactly right. Like, I think a knee jerk for us, like you just said, would be like, well, I can never trust you to ever reconstitute drugs ever again. You know, but for me it was a $300 or $400 teaching moment. You know, and saying, oh, this is an opportunity where you have the ability to now learn from it, hopefully not do it again in the future, but then also teach it. You know, is that if I would be more than willing to set $400 on fire if you now become a teacher of this particular thing.
Exactly. And that's where that base of forgiveness and humility interplay with each other. Because just because somebody they could have a lack of humility because purely out of ignorance, they could literally not know. And that's when you generate these teaching moments. But that's why forgiveness is also rooted in that, because if we as administrators or whatever you want to call it within your own clinic don't have this base of the desire and ability to forgive effectively, you're never going to trust that person ever again, because you cannot get past one mistake. You have to be willing to let that go. So just purely to provide yourself, or to provide them the opportunity to gain trust again. Like, you might not even trust them right away. But if you educate them using that experience, and they're receptive, you give them the opportunity to gain that trust again. Obviously, if they're defensive, or say I think that's useless, then bye-bye.
A totally different
opportunity.
But it's a complete loss of humility at that point.
But if you never give them the opportunity to hit the fork in the road and say yes or no, then you just wasted all your money on onboarding, hiring, training,
finding this person.
You just burned way more than $400. Way more.
Oh, absolutely.
So absolutely, do we want to have the moments where we lose these materials? Nope. But the cost of bringing in new staff and integrating them into the team is so astronomically more. It's like, well, let's at least give them the chance. We have to buffer our decisions within this one core value. And again, they're all interconnected, and we could probably use the same example for all of these. But that's a huge one. And all you're doing is providing them the opportunity to gain trust because you want to give it. Right? It's a mutual relationship. And if they decide to burn it, that's their own damn fault.
Correct. And I mean, think about, even from a cultural aspect, how basically the two ways culturally that can go. So employee constituted a bottle, reconstituted it correctly, just didn't label the bottle appropriately. Bottle got thrown away. So then we look at it from an administrative standpoint and saying, well, on one hand, it's like, well, let's learn from this mistake. But there are circumstances where you'll have where that employee just gets fired. How dare you lose $400 of my dollars? So what does that then do to the rest of the team? holy crap, I can't make any mistakes around here.
That's a short leash.
Because if I do make a mistake around here, that might actually cost me my job.
Yeah.
And I think that's the cultural side and that's why, again, core values is so closely part with culture, is that's coming into disparagement.
Yes.
That's coming into that one of those big cultural problems is now people aren't even allowed to make mistakes anymore. And I think the staff, that's why they're always, whenever we have these types of lost mistakes where we lost a whole bottle of something. No one knows where the hell it went. Not just this, but it was another circumstance where we had inventory loss. And I mean, it was a pretty substantial bottle again. What it was. But they're like, Carlo, how can you laugh these things off? And it all comes back to trust so one, we say employees fired, the whole culture goes out the window. But the other side is that if we overreact, not just in the fire situation, but it's like that might actually in those clinics might actually be the best thing that could happen to that employee is getting fired, which I don't agree with. But all I'm saying is that if then the alternative is you chastise them so significantly and they stay in your organization, it's going to be a terrible job.
Right.
They're gonna hate coming to work because it's like, oh my God, I made this one mistake.
Yeah.
And it's now and again, in those organizations, I would wager that they are hierarchical organizations, where it's very much a top-down thing is you just kick that person to the bottom of the totem pole. And are they actually going to be able to get back up?
Right. And then again, like going to the problem, crushes their self-worth.
Yes, exactly. Coming right down into the talent bubble. That is a hierarchical problem, crushes their self-worth. Then how do you get them back out? So like you said, I would much rather, burn a $400 bottle of medication if there's things that the team can take away from it. Oh, we have an employer that actually allows us to make mistakes, kind of laughs it off. Let's learn from it, not do it again. Let's teach it so and you can teach someone who comes after you. And let's not destroy your ability to gain trust in our organization because of a decision we made administratively.
Right.
That has nothing to do with in the workplace culture. That's what we did to that employee.
Right. Yeah, the other thing that you can add into that too is when you have the process of management post mistake, and then the individual bucks at it, then they get fired.
Sure, right.
That is one of the common phrases that gets kicked around a whole lot is be quick to fire. Well, I think a lot of times what happens is people are quick to fire upon the mistake, and then it's actually a detrimental effect because of that fact, right?
Yeah.
So to me, the quick to fire jumps in way more when it's like I give you the opportunity to own it and to implement, create a solution. Maybe not even implement it, but just say this is what I'm going to do better next time.
Yeah.
And again, we're jumping ahead into that
it's more into
accountability. But that's providing them the opportunity to be humble and to succeed in the future. If they bucket that system, I can't have you here anymore because you're now going to be the rotten egg within my system.
Yeah.
That's when you start to stick out like a sore thumb.
Yep.
That's when we just say, I'm sorry. Unless you can abide by this very, very small rule of just behavioral management,
right?
Like I don't have a place for you here because you, even if you do your job very, very well, you're missing the cultural side.
Yes. Which is so massive.
It's huge.
Yeah.
Because it has the potential to impact all of your other staff's job description, not just culturally, but just their actual list of operational duties so much because it's an attitude thing at that point.
It is, and it's like you said though, it's the attitude issue within humility and forgiveness.
Yeah.
Is that it's not just we're firing you, like you said, because of the bottle. It's that there is this innate process in how, as like a group or a set of workers or any of the other types of things is that just able to function together as humans. Like you can strengthen those bonds considerably by having humility and giving forgiveness. But like we kind of said, within that trust where either people are giving it too freely or they don't really know how to do it, I don't think you would disagree. Almost no one knows how to be like humble or have humility. Yeah. And then they don't know how to forgive. It's like, well, I'm going to say I forgive you, but I'm going to be really upset about this for a long time.
Right, which is not forgiveness.
That's not forgiveness. No.
So no, absolutely. We're again, as we become less trusting, I think there's a general sense, and there are obviously some can't think of the word. exceptions to the rule,
Yeah,
excuse
yeah,
me, that generally speaking, we are becoming less humble. We are becoming less trusting, and I don't like it. And I, that going back to the vision of PAW, it's like force of change.
Force of change.
This is how you start that force of change is through trust, through humility, and through forgiveness. The other thing that I'd like to touch on within trust, because that's within the team. But who's the other part of the team? It's our caregivers.
Yep.
So Brianna, one of our mentees, posted a thing that was just a simple picture from a whiteboard from some random clinic.
Yeah, I think it was like a veterinary site.
I don't know exactly what it was, but it was basically like the individual that wrote the post said, "I've come to love animals and not like people."
Yeah, but essentially.
Right.
Yeah. We're here. We do it for the love of animals. We don't do it for the people.
And the final piece was like, I'm grateful I'm not in human medicine.
Yes.
Right.
Yeah.
And to me, just looking at the function of a clinic and serving the patient, it's like, man, you are doing a huge disservice to that patient if you cannot find the trust in that caregiver, because trust in a caregiver, honestly, I would say falls on the staff. You have to educate them enough that you can now trust them. You have to drive these points home that they get it. And because the majority of patients walk out the front door, how well of a job did you do to generate enough trust in that person so that when they leave, it's like, that's going to go well. So, but there has to be an innate desire to give trust to that person so that they can, again, gain it and enforce that process. So, as a veterinarian, I guess my question would be, because, I fall much more on the caregiver side of things. How do you do that?
To, gain trust with the caregiver.
With the caregiver,
Yeah, honestly, I think it's kind of like we talked, before, was, a big part of it is figuring out how this person bond spectrum aligns. That's the first part. Because if you have someone that that their alignment has maybe a potential lower attachment to their patient, or I guess technically a higher attachment to their patient, in the end, they still want their patient cared for.
Yes.
However, the trust component is, if I have someone who is bond spectrum aligning low, and I put together a treatment plan and a treatment protocol that is for someone who bond spectrum alignment high, your low person is not going to enact it. One, they may just simply not agree with it. No, I'm not going to care for a patient that particular way. They may not actually understand it, where it's like, well, why are we doing all of these things? And it's like, I'm going to put a half hour into helping you. I'm going to explain and help you understand why we're going to be putting a treatment regimen together like this. But part of that trust and sort of giving and gaining is really trying to figure out where they are coming from. And I'm not saying that you are holding back on informed consent. It is very much your job to understand how this individual bond spectrum aligns, but then as a veterinarian, of course, to protect yourself legally, is to talk about informed consent. Here are all of our options that are available to you and your patient. What can we and what can't we do? What can we do emotionally? What can we do physically? What can we do financially? And that's then, I think, when you start to gain that trust. Is I've had, of course, the majority of my experience has been in after hours medicine, right? So when I have someone come through, one of the first pieces is, when we start to, I go through my clinical history, which may take anywhere from 20 to 30 minutes. We start to talk about plans, informed consent. We start to talk about diagnostic and therapeutic options. Is usually as I start to talk about 1 test, 2 tests, 3 tests, 4 tests, everything that comes out of my mouth is almost exclusively scripted. I've said it for 13 years. It's no thought of me saying it. But what I do is I look at them and I'm like, all right, what are the facial features they're doing? You should look, for anyone who hasn't or is aware of it, is the micro movements of your face, So it's, people who are really good at reading liars, you're really good at those micro movements. That's what I do, is I actually look at people and I'm like, how do they actually respond when I'm talking this way? And the easy ones are like this, when you're like, oh, I think we need to do blood work. Ugh. Okay, that's an easy one.
Yeah.
Right. That's an easy one.
Yeah.
So anyway, so getting back to how do we gain that trust, is that, I say, oh, this and this and this and this. And I'm like, okay, they're getting more uncomfortable. And I say, listen, one of the things that as an organization that we've been working on, I know this may be your first experience with us here, but my business objective or my business model is to have no change in price from 2 a.m. to 2 p.m. And I want those costs to be comparable to what you're going to find at an area veterinarian. I said, we don't play this game where we have this upcharge just because it's after hours.
Right.
And that's part of the reason why we don't have emergency on our sign is we're a 24-hour animal care center. 2 a.m., 2 p.m. There should not be a change in price from 2 a.m. to 2 p.m.
Right.
And it be very cost comparable for the area. I say that to people, gained it. They're like, oh,
yeah.
We are here to focus on how to serve the patient. Yep. And I tell them, I said, there is an expense to keeping the lights on. There is an expense to having the medications here. I said, so we have a huge range at which we can do. I said, really, my goal is to work with you on this to see what we can do for your patient.
Yeah.
Done. There's another one.
Yep.
So to talk about that gain is, give and gain trust, as a part of it is, we're trying to gain their trust. We're also trying to give, trust to them that they're going to be able to enact certain parts of this treatment method. But that's where it then comes back to how we've established these problems within our industry, or at least we've identified these problems within the industry, to say this lack of service infrastructure, are services available and affordable? Do we have, sort of our culture spectrum alignment appropriately? Yep. And then it comes into how we translate that over to the caregivers is I'm vocal about it. I don't need these people to try to guess any of this stuff. It's like, just give it to them. Just put the information out there. It may stick. Some people will be like, why are you telling me this? I don't care. Yeah, go ahead and go do it. Oh, well, perfect. That's fantastic. But I think, for when we start talking about the vast majority of caregivers is, especially if it's an environment where they have never been before, it's you have a very short window in which you can both give and gain trust.
Yes.
And that's then when you would be, I think we all are aware of this, when the doctor leaves the room and the tech comes in or the client goes out to the lobby and talks to the caregiver support guide, this is then how that branches out into trust within the team. Yep. Is, like one of the examples we had when we were going through, sort of the center sections about the one gentleman, where it was like, someone told me it was going to be $600 to walk through the door. Not anyone from my team, because I have the trust in the people I work with that no one would say that. Right. And, so then for me, it's like, oh no, I swear, I'm like, okay, well, here's the person who we were talking on the phone. I'm going to go talk to this person because this has a direct bearing on their job performance. Yeah. If they are telling people this by phone, you specifically, that's a huge problem for us. And I'm going to go talk to this person. Oh, well, no, I don't want you to do that. It's like, okay.
I guess I'm not that sure about it.
I guess I'm going to have to second guess myself, but I don't. Is that because of the trust that I have in my staff? I'm not saying that I openly give trust to everyone in the staff, because I am, again, very reserved in sort of that trust allocation. Yeah. But I'm also very aware of, that person over there who maybe hasn't gained as much trust within the staff, they are really in their first few months. Like, I maybe don't trust them as much. However, I'm going to ask them about it. What do you think about this situation? What do you think about this? What do you think about that? And start to say, this is the circumstance we had. Do you think you had anything to do with that? So it's okay to have this, constant loop on
Well, you're
trust.
just generating learning opportunities.
Absolutely.
And the same thing.
Yeah. Yep.
So that's trust is an interesting one for obviously for a number of reasons. But as individuals are looking at our industry overview here, they'll notice that there's arrows that go to the next one.
Yes.
So we've got the idea of on-team trust and caregiver trust, which is kind of that's our two big ones.
Yeah, yeah.
There's no reason for me to not trust a patient. I was most of the time,
right.
But that's a skill.
There's a communication
there is a communication there
between us and patients.
Whatever it might be, we do what we can to trust our patients.
Yes, right.
But as we follow the arrow, we get into respect and respecting each other as in the team, and respecting caregivers, who is the other half of our care team. And really those two are so horribly connected.
Absolutely.
Because, a lot of times what I think a lot of people would say is like, yeah, I'll give trust, but you have to earn respect.
Yeah, sure.
Right?
Sure.
Which honestly, I get it. I understand where that phenomenon comes from, but from my perspective, it's like if I wait, and this goes with trust too. It's like if I wait for you to give me the opportunity to trust you or to respect you, and you're doing the same to me, we're never going to get anywhere.
Yeah.
It goes to the same, and I believe we had talked about it in service, where it's like it's no one's fault.
Yeah.
Right. And this is directly related to that same idea, where it's like all we really need to do is just understand that if we have a lack of respect or we have a lack of trust, it's probably no one's fault. We just haven't made the move on it. So just be the first mover. Just get the ball rolling.
Yeah.
And then if they stop the ball and say, nope, we're going to come back here, like that's the exit strategy at that point.
Right.
So when we talk about respect and we talk about respecting each other, a lot of times we're not waiting as a group within our team. It's like, nope, you're here. I'm going to provide you the utmost respect, even if I have no idea who you are and you have not earned it, in the traditional sense of not earning it. However, if you decide you want to take it away, like, we're going to talk about it, right? Yeah. So from an administrator's perspective, in owning a clinic, what are your thoughts within the team and providing that level of respect for your entire staff?
Yeah, let's honestly just take that hard segue from trust into respect.
Yeah.
How do people actually get into our organization? And again, we're going to touch on the TriCore and onboarding and performance review process. That's going to come at a later time. But to make that move from trust into respect, like, you have to earn my respect, right? So like you said, who's going to make the first move? Our hiring process is I would consider very pure, between scouting to interviewing to working interviews to now we're talking about actually, the TriCore assessment, of course, is part of it, but to go through the onboarding process, is that we as administration are basically vetting out all the people who are not going to align well within our organization.
Yeah.
So to make that hard jump from trust into respect is actually now the employees' trust with administration.
Yeah.
We did our job appropriately to put someone in the team who is actually going to fit into this team very well. Respect them. We respect them enough for them to have a job in our organization. Now, again, like you said, there's going to be opportunity when, even like we were just talking in the trust category, where it's like they have the opportunity to be, humble or have humility and provide forgiveness, and they don't do that. Okay, well, now we're starting to shift sort of the trust component. But to earn our respect, no, they're here.
Right.
We are not an organization that you put an application and you get hired because we need help.
Right.
It's just like anyone, I don't care who you are, come on here, PAW Health will hire you because they're hiring. No, we are actually very, very selective.
Yeah.
So when we start to talk about respect, we all pretty much start on this level playing field. But part of it is then coming back into what is the issue with talent and self-worth. We're talking about hierarchy again, to say, well, you need to earn my respect. And it's like, I've been here longer and you're just coming into the team. You need to earn that respect. And it's like, well, what if by chance the person coming into the job has twice as much work experience as the person you got to earn my respect. Maybe they in the profession 5 years and this new hire is a 10-year. And it's just like, oh, well, now we got, the veteran coming in here. They got to earn my respect because they're coming in with all the fancy skills, So that's what we start, even then a new veterinarian coming into the team, a new technician coming into the team, or a veterinary clinic who has no certified licensed or registered technicians. They only have unlicensed technical staff. And then you get that new veterinary technician coming out of school, degree carrying, certification carrying. They're coming into a practice where now they have all the certification. It's like, you need to earn my respect. It's not just like, oh my God, this person deserves respect in some capacity because they just put a ton of work and effort into gaining that degree. Now we're talking about, the people now coming in. And so that's why I say making that hard move from trust to respect. The hiring process is not as pure in a vast majority of clinics. It's like, we just need help, you're hired. Overall. I
mean, really, because I believe at least Wisconsin is less than 3% unemployment. Across the nation, it's like 4%.
Yeah.
There's a lot of body hiring that's going on across the nation.
yes.
that is creating that effect.
Well, and that's even around here, all the businesses. I mean, they're half staffed.
Yeah.
You know, of course, there's very little unemployment because it's like, oh my God, we need more people. You know, so yeah, exactly that. So, like you said, I think coming back to your original question of, you know, sort of what, you know, administratively is sort of important about this respect dynamic.
Yep.
Is a part of it is actually leveling the playing field and sort of leveling this hierarchy on who has more tenure, who doesn't. Because again, for us to come back to the sort of trust part and to saying, well, a lot of in trust is saying, you know, I know what I know and I know what I don't know, meaning
Yep.
I am and I am not comfortable with this. I don't really know how to do that. Respect is someone is now saying, you know, from a trust perspective, I don't know how to do this, and I'm going hopefully to gain trust because I'm going to be taught how to do it. I'm going to learn how to do it. Respect is like, yep, I respect you enough as a person to teach it to you.
Yeah.
You know, and I'm going to respect you enough as a person. I might have to teach it 3 times because eventually it's going to click.
Yeah.
You know, I mean, when I have a consultation with a caregiver, because that's another part of it is respect caregivers,
Yep.
is when I have a consultation with a caregiver, I mean, I have gotten better in my tenure that I don't heavily load people with information. I mean, when I go into a consultation, I really, you know, again, part of it's reading them, part of it is, you know, where sort of their education level, their cognitive ability, and it's like, all right, these people, oh, you're an RN. Like I say to people, when I have nurses come in and they're like, well, you know, I am a nurse. I'm like, thank you for telling me.
Yeah.
I'm like, honest to God, thank you for telling me that you're a nurse or that I'm a doctor. Thank God. Okay. Now listen, there's a lot of stuff on the human and veterinary side that really have a ton of overlap. And I always kind of make the joke. I said, don't forget most drugs are tested on animals before they go to the human side. So we had the drugs first, you know, so they kind of laugh about that. You know, but, you know, so part of it is in respecting the caregivers, you know, is, you know, if I say to them, and that's why I say, thank you for telling me that you're a nurse. I said, I know that you have a higher level of medical education than a lot of the people who come through here.
Yeah.
Stop me when you don't understand something, but I'm just going to start talking. I'm going to give it to you straight. And I don't have a problem describing it, you know. So that's like the first one, respect caregivers. Why are we battling people from the human side? You know, why is it that we assume, well, you know, I have again, coming back to sort of the hierarchy and disparagement is I have the information and I'm going to be the one that gives it to you. It's like, no, how much do you know?
Right.
How much do you know? Because I'm going to do a little less work in this consult because you understand.
Well, and what did Dr. Google say?
Right.
Like,
oh yeah,
how much was he right? How much was he wrong?
Correct.
Like, let's just figure out where we are.
Yeah.
Let's play on the same field here and figure out what we're going to do to serve the patient.
Yes.
But ultimately, we had talked about it in our all staff meeting. All you're really saying is like the caregiver deserves the respect enough to say for us to understand that we're all on the same team.
Absolutely. No, and thank you for bringing that because that's point 2.
Yeah.
Is the first one is, you know, how much medical background does this person have? The second one is I'll have people who come in and this is all respect.
Yeah.
They come into me and they're like, oh, you know, I researched this on the internet. I know I'm really not supposed to do that. I'm like, why?
Yeah.
I'm like, why?
Yeah.
I'm like, I love when people come in who have searched things on the internet. I said, because here's the reality. The reality is you are an engaged caregiver who wants to learn on what they can do for their patient. They don't have any other access to information other than the internet because when they go into a veterinarian, this comes into then respect number 3 is if they start asking a ton of questions, they are then disparaged because to answer questions is annoying. Why don't you know this?
Right.
You know, so on one hand, we're fighting the medical community, we're fighting the self-education community, and then to come into the third part of respect, and as far as saying, you know, for us to then to the respect caregivers. When I go through my whole consultation with people, now we're talking pre-diagnostic consultation, post-diagnostic consultation, pre-treatment consultation, post-treatment consultation. Okay. So probably didn't get that specific, but all of those are opportunities for questions. And I'll tell people, you know, I'll just let all this information out to them. And then I kind of look at them and say, what sort of questions do you have for me? And they're like, there's 2 answers. One is we don't know, or 2 is we're surprised we don't have any.
Oh,
you know, because the second one is I've done my job to create this whole circle on saying, here's what you came in with, here's what I found on physical, here's what I found on diagnostic, and here's 1, 2, 3 different options for you based on these diagnostics. And then if this does or does not succeed, here's where we can go. Yeah. So sometimes people would be like, no, that was amazing. I'm like, yeah, I know, I've been talking about vomiting for 13, 14 years. Like, you can only ask so many questions about puking and so many solutions to diarrhea. That's just sort of what it is. But again, you know, in coming into that, I always end it with saying, now listen, I said, I know this was a lot of information for you guys right now. I said, but everything I just said, I can probably say back to you with incredible detail and is almost accurate as I said it the first time. I said, I don't care about that. I am more invested in you understanding what's happening right now.
Right.
So for me, it's, I don't fight the medical community. I don't fight the self-educators. I don't fight people who have multiple questions, because ultimately in the end, our job is to serve the patient.
Right.
And then we've recently added educate the caregiver.
Right.
You know, I mean, that's a big part of it.
Right.
So, you know, in that regard, to then say we're respecting the staff, we're respecting each other, we're respecting caregivers, as we start to reduce conflict, we start to reduce opportunity to when we're going to get annoyed. And for me, and this is all stemming off of, you know, sort of you saying the post from Brianna on saying, I'm so glad I'm not in human medicine. I'm so glad I don't have to work with people.
Yeah.
It's like we're in a service industry.
Yep.
You are working with people. You're working with people in the workplace. You're working with people on the other side of the door and the caregiver side.
Yep.
This is all part of who it is and what we are and what we're doing, and we have to all be respectful of one another. And if you work within an organization that has a toppled totem pole, all employees are going to respect each other. And if we start to include caregivers into our medical team, because that's how they got their name, they are included in our medical team. Now we're starting to build this group where our all and sole purpose of that team is to care for the patient,
Right.
is to serve the patient.
Yep.
You know, again, for us, even on that self-education side, I kind of cruised over it, was that whole concept is where we drove our caregiver resources.
Yes. Yep.
You know, caregiver resources, you guys can go onto our website. There's a whole section on caregiver resources. I think we have 137 different documents of common diseases.
Yep.
And, you know, the thing with caregiver resources is we print those out as our own discharge instructions. You have a patient come in with roundworms. Here's our roundworm handout. Here's this, here's this, here's this. We put 2.5 years into consolidating and developing these materials, not because there wasn't other things out there, but I kind of make a joke. If you can't say it in a page, it's not worth saying.
Right.
You
And,
know,
no one's going to read it either.
no one's going to read it. Here,
Yeah.
let me print off this thing from this one website on heart disease that's 5 pages long.
Yeah.
It's not going to happen.
No.
And we didn't cheat the system where it's like size 7 font and we squeezed it all onto
It's
one
all size
page.
10.
Yeah, it's all, yeah, right. That's technically true. Yeah, because 12 is, who reads 12? But anyway.
Children.
Yeah, children. Yeah, and grandmas. Right. But again, so it all sort of comes back to this kind of commingled respect.
Right.
You know,
Right.
and I think that's why, like I said, this hard move from trust into respect, that's ultimately the big picture, is how can we sort of weaponize our caregivers to have the information they need to help serve the patient? How can we sort of flatline out this hierarchy so that all of our staff respects each other equally, so that we can then support the caregivers who are then going to help serve the patient?
Right. Yeah. The way that I've worded it for a very long time, and actually it started with a marketing conversation when our marketing individual had come over about a year ago, almost exactly, is that one of the key differentiators with PAW that we noticed in that conversation was we want to produce ready, able, and armed caregivers.
Yep.
Caregiver resources are a great way to do that. We have a full pharmacy that's in-house, lab work, all that sort of stuff. And with all of that, that's pretty much what you're getting at, is you're now creating somebody that's a part of your care team.
Exactly.
And for the individuals that are listening, that might, I understand, I can at least empathize. I'm not going to sympathize, but I understand when it does feel like there are difficult caregivers in the world, because it's going to happen,
Yeah,
right?
it happens.
And really the first step is just be bigger than it.
Yeah.
That's that first mover advantage
Yeah.
of just get the ball rolling, and
Yep.
ultimately you know where that patient is headed.
Yep.
They're going out the front door with
Yep.
this individual. Respect them as best as you can.
Yep.
But the second thing too, especially from an owner's perspective, is when we get into the TriCore assessment, we'll talk a lot about motivators.
Sure.
Is just understand where your motivator is going to come from to fuel that respect.
Yeah.
So if you're highly aesthetically motivated, which we're going to dive into, but that you're highly aesthetically motivated, you're very conflict averse. So the more that you respect this person, the more that you just give and give and give to them, and provide as much education as you can, you're limiting the opportunity for conflict with that person.
Yeah.
Right.
Oh, absolutely.
So we've got that.
Yeah.
A lot of the individuals that are in our industry are highly aesthetically motivated. So I'm guessing a lot of people listening are going to be like, yeah, like if I can avoid conflict as much as I can, like let's do it.
Yep.
But then moving to one that typically is like the mirror image is economically. So not necessarily always money, but return on investment. So that one for me personally is the one that I fight the most just with difficult caregivers, because a lot of times like my gut says this person's not going to get it, as the flies right in my face. And like I don't, there's like my gut says I don't want to put the time into this person because it's not going to be worth it.
Yeah.
So
and that's the big thing with the economic motivator. People need to understand is it's not money motivation.
No.
It's if I'm going to put something into it,
it's return on investment.
Return on investment.
So I'm highly economically motivated because
even
I love
energy
return.
in is an investment.
Yes. So with all of that, you can really just shift it and say, if I don't give this, the likelihood of me getting any return on investment, almost none.
Yeah.
So it's just shift whatever the mindset has to be to motivate yourself to go do it every single time.
Yeah.
And what it's going to do over time is, number one, your caregivers are going to be on the same page more often than not because you're just putting it out there.
Absolutely.
But it's also going to provide you a level of fulfillment and start to get rid of this loss of self-worth because you're doing your job in a way that is fulfilling to you.
Yes.
So again, you're fighting a lot of different things at once by purely just aligning trust and respect with how you're individually motivated and understanding who the care team is, because again, we're all here to serve the patient. Take those three variables, align them with serving the patient, and boom, you kind of just beat failed bond spectrum, at least to a point.
No, almost entirely.
Almost entirely. And now, because you're doing that, you're also defeating this loss of self-worth.
Yes.
You're at least headed in the right direction. It's not that that's the end-all, be-all solution, but we just talked about two things that are, all right, now you're running out of this hurricane. Now you're getting out of the eye of this storm, and it can be tough. I would say that giving trust in not blindly, but just making the first move is difficult, and especially with trust and respect. But without those, and we're gonna get to the next two in our next episode. It's almost impossible to have a unified team if you don't have those two, including caregivers, again, because they're a part of our care team.
Absolutely.
And the other thing at the end of all of this is, if I don't have a unified team, if I didn't really respect the caregiver enough to educate them, if I don't really trust anybody that's here, accountability is never anything that's going to be effective. All it's going to do is just crush your team every time. You're gonna poorly fire fast, or your performance reviews are going to be useless. Ultimately, we're going to get to the last one, and if you don't have the first three, and that's why they're all interconnected, is they all work together. You lose one, you lose them all.
Absolutely.
So just
and strategically, that's why respect is at the bottom of that, and accountability is at the top. Is like the foundation of this whole sort of core value is respect. Because there's, like you said, there's no way you can sort of get to the other parts. The other parts are equally as weighted. I mean, I would say accountability is like really what you're trying to go for is just having absolute accountability at all time. But because it feeds into those other things, that's what sort of sends your loop. I mean, it's basically sends the hurricane in the other direction.
Exactly. So that'll be all for this week. Again, hitting trust, hitting respect. Next week we're going to cover the other two in unity and accountability, and then how all of these four items really fit together in a direct attack against the problems that we are seeing as an industry. So stay tuned. Come on back next week, and we'll cover a unity, accountability, and finish off the idea of how core values can really make a big difference in your practice.
Absolutely. See you guys next week.